Good afternoon. I'm Father Miles Sheehan. I'm the director of the Pellegrino Center.for.Clinical.Bioethics, a professor of medicine, and the David Lawler Chair of Catholic Healthcare Ethics here at Georgetown University Medical Center. I'm happy today to be introducing in a moment our speaker, Dr. Daniel Daly, who's the Associate Professor of Moral Theology and the Executive Director of the Center for Theology and Ethics and Catholic Health Care at the Clough School of Theology and Ministry. But before we do that, I'd like to invite on stage Dr. William Sullivan from the Kennedy Institute of Ethics. And Bill, would you tell us about a special program that's coming up that might be of interest to those who are joining us on this webinar?
I would be delighted to. Thank you for this opportunity. So I wanted to mention very briefly that the intensive bioethics course that's being offered by the Kennedy Institute of Ethics and the Pellegrino Center for Clinical Bioethics at Georgetown is taking place this year, June 9th to 11th. And this acclaimed course is now being offered for its 47th time. And we have a few new features this year that we hope will enable people joining the course to learn some new things that will be very practical. And I'll just mention what's new. So the first is it's a case-based format. And the cases are all meant to illustrate the themes that are going to be discussed. And each case is being co-facilitated by people with expertise on the clinical side or the second person expertise on the philosophical, legal, policy side. And so it's this effort to integrate these with each case. The second thing that's new are the special events. And one is a keynote presentation by our own Christine Grady, who's going to be talking about the common good in public health care policy, and a panel discussion by Father Miles Sheehan and Laura Donardis on AI and healthcare. And then there's also a movie night, and the theme of the conference this year is caring in times of crisis. And this movie night is going to focus on this whole theme of caregiving. And that's being facilitated by our own Professor Laura Bishop. And then another new thing are these special topics for deep dives. And we have 9 of them. I won't go through them, but we're hoping people will find something of interest for one of these topics to kind of have a deep dive on some very specific topic. And then there's opportunities for research, kind of collaboration. So throughout the course, the Bioethics Research Library is open with extended hours, and there's information specialists available to people to help them. And as you know, this is the largest collection of bioethical materials in the US and possibly in many other places. And so we encourage people to come with questions that hopefully will have some opportunity to ask and be answered. And then finally, it's a networking opportunity. So all the faculty of both that are involved from the Pellegrino Center and from the Kennedy Institute are there for 3 days. And there's lots of opportunities for engagement, not only with the faculty, but with others who are typically from a very broad range of disciplines and places. And so it's a great chance to, meet new people, collaborate, and network.
Thank you very much, Bill. I appreciate you joining us, and I appreciate Dan's forbearance for this commercial announcement as we proceeded along the way. Let me more formally introduce Dr. Daly. I actually first met him when he was at St. Anselm's College in Manchester, but Dan is the Associate Professor of Moral Theology at the Clough School of Theology and Ministry at Boston College, and he's the founding Executive Director of the Center for Theology and Ethics in Catholic Healthcare, sponsored by the Catholic Healthcare Association. Dr. Daly earned his PhD in Theological Ethics at Boston College in 2008. And before joining the faculty at the Clough School, he was Associate Professor of Theology at St. Anselm College in Manchester, where he also served as the Theology Department Chair for 5 of his 13 years. His academic work focuses on healthcare ethics, virtue ethics, and the ethics of social structures. And I'm happy to introduce him with his topic today, Deliberating with the Virtues and the Virtuous, an Ethical Framework for the Practice of Medicine. For those of you during the conference who have questions, if you take a look down at the bottom of your screen, there is a circle that says More. If you click that, it'll have Q&A, and you can put a question in there. And I'll try to select some of the questions for discussion at the end of our presentation. So Dan, thank you very much for doing this. And if you take it away, that'd be great.
Well, thank you, Miles. Can you see my screen?
Yes.
You can see the slides? Okay, good. So thank you, Father Sheehan, and really the entire Pellegrino Center for Clinical Bioethics at Georgetown for the invitation. It is an honor to be with you to deliver this lecture. And before I start, I'd like to thank my research assistant, Leela Gallery, for her help with putting this together. And as I said, it really is an honor to deliver this year's Pellegrino lecture, to honor a man who I never met, but who has guided and inspired me for decades now. So thank you. And my goal in this presentation is to, reflecting on Dr. Pellegrino's work on virtue as a point of departure, argue that healthcare ethics benefits from, as the title indicates, deliberating with the virtues and the virtuous, an ethical framework for the practice of medicine. I'm not going to make the claim that this is the only framework we ought to use. The claim is really that it is a framework that we can use, that is insightful and provides a methodology that helps us to better enact healing, which, as Dr. Pellegrino taught, is the purpose of healthcare. And the reason I make this argument today is that such an approach of looking at the virtues and the virtuous is largely absent in the literature in healthcare and medical ethics. I'm just trying to, okay. Now, this is by no means the fault of Dr. Pellegrino. His work remains a clarion call to take a virtue approach to medical practice. And he invites medical professionals to cultivate virtuous character, to become real healers who practice beneficence, justice, and mercy. And healers need education in the virtues, and he calls us to that in some of his writings. And today we tend to call this formation. We talk about formation. And one of the important things to know about formation is that formation is different than information. We become virtuous because our heart and our habits are formed through how we feel, how we desire, and what we do. And so, if you think about analogies, you become a golfer by golfing, you become a writer by writing, and you become merciful by doing the works of mercy. And this is certainly present in the writings of Dr. Pellegrino, where one of his influences is Aristotle. And I've pulled this quote from the Nicomachean Ethics, Book 2, where Aristotle writes, "For the things we have to learn before we can do them, we learn by doing them. For instance, men become builders by building. So too we become just by doing just acts." So we enact our way to the virtues. We don't become simply who we want to become or who we desire to become. We become what we do. I should say we become what we do. We do, and that is who we become. And one of the ways to test this is, I could ask you, how many of you have kept your New Year's resolutions? We all may resolve or have a desire, have a movement of the will in a way to become a different kind of a person. We know through experience that the only way that we become that kind of a person is by enacting it, doing it over and over and over again. We act our way into the virtues. We don't learn our way into the virtues, although learning can be a part of the virtues. So in Dr. Pellegrino's work, we see this real focus on developing and then practicing the virtues. is that his work also identifies really interesting limits of the virtues, and I'm gonna kind of play around with that aspect of his thinking. One of the claims that he makes in a chapter, an excellent chapter in the edited volume that I'm sure you're all aware of, and I'm sure own, is Pellegrino's Clinical.Bioethics, a compendium published by Georgetown last year. Just an incredibly rich volume. We want to thank the editors for putting that together. In that volume, there's a chapter, The Moral Foundations of the Physician-Patient Relationship. There's a subtitle about military ethics, and in that chapter, Dr. Pellegrino writes, virtues lack the specificity and concreteness of principles, rules, and axioms as action guidelines. So essentially, he claims that virtues don't provide action guidance, or they provide limited action guidance. And he gives 3 reasons why this is the case. First, virtues tend to be multivalent. Others have said they're semantically confused. We have many different definitions of each virtue. Take, for instance, the virtue of prudence. Is prudence cautious self-interest, which is the way that it often gets articulated today? Or if you look at Aquinas, is in Aristotle, is it the capacity to discover the right means to the good end? All right, so, but again, the concept of prudence is multivalent, as many virtues are. The second limit of the virtues is that they tend to conflict with each other. Classic conflicts exist between virtues like loyalty and justice. So if you had a close friend who you knew damaged someone else's property due to driving under the influence of alcohol, would you turn that friend into the authorities? Your loyalty to that friend might lead you to protect him. Justice, giving to others what they're owed, might lead you to turn your friend in. But there's a conflict here, and most virtue theorists don't believe that these conflicts can be easily resolved in and of the virtues themselves. They are real conflicts. Aquinas would tend to see these as resolvable conflicts, but that's beyond the scope of this lecture. And the final limit is the problem of subjectivism. Which virtues are you choosing? Are these just kind of subjectively chosen? What's your account? I mean, this goes back to the problem of multivalence. How are you using the virtues to guide action? So there are issues within virtue ethics that limit the ability of virtues to serve as action guides, exactly as Pellegrino writes. So his position is, again, that there's a limit here within the virtues. So what he turns to is he says, look, there needs to be a complementary relationship between principles and virtues. Principles which provide more stronger action guidance, more apparent action guidance. The principles deliver for us right action. They help us to discover the good and right action. Virtues provide right motivation to do the good and the right application of principles. So for instance, if you don't have prudence, you cannot use a principle to discover the good and right action. Principles don't self-apply. They are only applied rightly by prudential reasoners. So he does see a room for the virtues in delivering the good and right action, but it's that we already have the virtue. We need to have the virtue. What he doesn't see so much is that the virtues can be used as tools to discover the good and right action. But he has good company. Dr. Pellegrino has good company in his hesitation to allow the virtues to drive action guidance. This is a long-standing critique of virtue ethics. You see a few quotes here that I pulled from thinkers. Robert Loudon in the mid-'80s wrote, "People always expected ethical theory to tell them something about what they ought to do. And it seems to me that virtue ethics is structurally unable to say much of anything about this issue." So Loudon is really capturing the zeitgeist regarding virtue ethics, but it doesn't tell us what to do. It doesn't provide action guidance. The philosopher William Frankenot wrote, "Virtues without norms are blind." The virtues can't see the good and right action. They can't discover the good and right action. We need norms. Norms will guide us to the good. On the flip side of that, Frank Kenna wrote that norms without virtues are impotent. That if you have a norm, let's say the 10 Commandments, but you have no virtue that drives you to do the good, the norm itself is impotent. It doesn't actually end up moving you to follow the norm or to live it out and prudentially discern how it should be enacted. Rosalind Hursthouse is as you see her on the left, slightly more sanguine. She writes that virtue ethics only produces an account of a right action under pressure, and her work does some of this. But again, she doesn't think that it's obvious how virtue ethics delivers the good and right action. So what we need a method that has a very clear decision procedure. We need methods that provide some kind of a formula to help us to figure out what the good and right action is. And this comes out of the Enlightenment. Enlightenment thinking tended to move all sciences toward the creation of formulas or laws. If you think about the academic world post-Newtonian physics, where Newton, creates the laws of motion, pretty quickly, all sciences have to follow along the same basic structure. They need to be reducible to formulas or laws to withstand testing in the academy. And the virtues just don't pass that test. As Dr. Pellegrino wrote, they're too multivalent, they're too subjective, they're too in conflict. There's no law that you're discerning, you're developing out of the virtues. Virtue appeals to prudence, not formula. It appeals to deliberation. It appeals to taking counsel with others. And this is much too squishy for Enlightenment era thinking. And so what we have is methods that have very clear decision procedures that are developed. So we can think of utilitarianism and its kind of broader parent consequentialism that's represented here by Jeremy Bentham. We can think of deontology and Immanuel Kant's categorical imperative, which provides a formula that you can test your maxims through the categorical imperative. On the right here, we see Beecham and Childress, who we know very well through their principalist methodology. And we know that James Childress has sympathies with deontological thinking, right? Rules-based, duty-based thinking. And Tom Beecham had sympathies with a utilitarian approach to the moral methodology. And all of these methods provide clear decision procedures. Utilitarianism has a calculus. Bentham describes it as a calculus, right? He is an heir to the legacy of Isaac Newton. And principalism does in a different way. But it does have a clear decision procedure insofar as Beecham and Childress call us to specify each principle for the case that we're considering, then weigh and balance the principles to figure out the correct course of action. So it's not quite the level of a calculus that Bentham suggests, but it does provide a clear decision procedure for us as we look at different cases. Now, we can challenge aspects of these different methodologies, whether it's utilitarianism or principalism or deontology, but they do claim to provide, and they very well may provide, strong action guidance based on clear decision procedures. And before I continue, I just want to recognize, given the venue here, the profound loss to the world of biomedical ethics upon the death of Tom Beecham last year, who I know was more than a brilliant scholar for many on this call, but was a colleague and a friend. And his contributions continue to guide ethical practice in medicine. He has an incredible legacy, and may he rest in peace. So, where does this leave the virtues in the moral life, but more specifically for our purposes today, in the deliberations of the healthcare professional? What's their function? What's their use? And as I see it, the tradition has two basic answers to this question, one much more dominant than the other. The first is that virtues are traits to cultivate and to practice. The virtues are traits to cultivate and to practice. And everyone who does virtue ethics or thinks in terms of virtue theory agrees with this. That the overwhelming perspective within the virtue universe is that we should practice, we should habituate the virtue so that we can then do the good with a relative level of ease and joy. That's the purpose of the virtue, so that you become the good, you become the just, merciful, prudent, loving person who then, with a certain level of ease and joy, does the good. That the virtues remove some of the difficulty, not all of the difficulty, but some of the difficulty in the moral life, so that we can discover the good and then do it. The other answer, the other use of the virtues is here on the right, virtues as action guides themselves. And here we have St. Thomas Aquinas as the thinker who does this. And when we think about action guidance, and I'll talk more about Aquinas in a moment, but when we think about action guidance considers the question, what shall I do in this situation? Or what shall I do in a situation that I will be shortly confronted with? And virtue action guidance then describes the deliberative processes and methods by which one would go about answering that question of what I should do. Right? So we've got kind of theories of action guidance, and then the actual action guidance that methodologies provide. And when we return to utilitarian thinking, what Bentham does is he provides a very clear decision procedure. He says, when you're considering between two different actions or multiple actions, you have to do a number of things. First, you compare the intensity of the pleasure or pain that your action will cause, the duration of that pleasure or pain, the certainty of that pleasure or pain. Is it certain that it'll cause pleasure, or certain that it will cause pain, or uncertain? The fecundity and the purity of the pleasures and pains that your action will cause. Will your action cause pleasure now but pain later, or pain now but pleasure later? Right? What comes from down the line the action that you perform? And then you're supposed to do the act that on balance creates the greatest pleasure for the greatest number of people affected by that action. Right? So a very clear decision procedure that is like a calculus. Again, you could think about this as mathematics, ethics as mathematics. And then we have Aquinas. And Aquinas doesn't look like the moral life as a kind of a mathematical activity. He sees the virtues both as traits to cultivate, and he uses them as action guides. He uses the virtues when he's deliberating about good and right action. He reflects on the good and right in light of the virtues, not in light of secondary moral precepts or what we would call norms. He has many, it is the overwhelming preponderance of his writing in his moral treatise is on the virtues. And as we turn to that treatise, so the Secunda Secundae, this is where he develops the virtues. He goes in depth on the virtues. And the prologue to the Secunda Secundae gives away his approach. He writes there, we may reduce the whole of moral matters to the consideration of the virtues. Now, what does he mean by that? He doesn't mean that the Ten Commandments have no room in the moral life, or that norms don't have a place in the moral life, but he organizes his moral thinking around the virtues. Norms derive their importance and their truth because they're related to the virtues. Right? The virtues organize other moral categories. And what he does in the Summa is he prudentially, it shows him prudentially deliberating with the virtues. You think about, first what he does is he develops these really thick accounts of each virtue. His question, he writes 66 questions, for instance, on the virtue of justice. It's an enormously long, dense, complex treatise on justice. But then he uses that thick account to discover right action in a variety of areas of life. So justice for him guides how we use property and money, and guides a number of other things, such as religion and you know, truth telling, all of these things are related to justice. When he thinks about the drinking of alcohol, he turns to the virtue of temperance. And temperance provides action guidance about how we should drink alcohol. Mercy provides guidance in terms of how we should act in relation to those who suffer. So he doesn't go in depth about exactly how that, he doesn't have a theory of action guidance that's fully fleshed out. I will do that a little bit later in this lecture. But he certainly does it, right? We see his method enacted even if he's not reflecting on it in the Secunda Secundae. And something that I think doesn't get enough attention, there was a great book a number of years ago by Mark Jordan, and I'm drawing a blank on the name, where Jordan invites us to read the Summa backwards. And he says, we should begin with the third part, the Tertia Pars, because the Tertia Pars is about Jesus. And Jesus here is held up in the Tertia Pars as a moral exemplar. And it's an underappreciated aspect of Aquinas' thinking, is that he does this kind of moral, draws on these moral exemplars, specifically Jesus, in the Tertia Pars. More on exemplars later. So let's test these different methods in real life moral reasoning. There's a famous thought experiment by the philosopher Peter Singer that he developed in a probably his most widely read article, Famine, Affluence, and Morality, back in 1972, an early article of his. And very briefly in that article, he draws this thought experiment up, where he describes a situation in which there's a person walking past a shallow pond, and a small child is struggling and drowning in the pond. And the person who's walking by has nice clothes, nice pants, nice leather shoes. And, the dilemma here, the way that Singer draws it up, is that that if you go into the pond, if this person goes into the pond, his shoes and pants will be ruined, right? And so the question is, what do you do? Now, he says, you obviously go in and save the child. He writes, and I think in an understated fashion, he says, it presumably would be a very bad thing for the child to drown. I think that's understated, but nevertheless, at the moment, we know that we ought to go in and save the child. Singer's thinking about this in terms of utility. He's a utilitarian. There's an obligation. The only good act here, the only act that promotes the greatest good for the greatest number, is to go save the child. So it's an obligatory act in this way. So on the right-hand side of this slide, you see Julia Annis, who's a philosopher at the University of Arizona. And Annis takes up this case, and she asks, if you found out that someone walked away from that child, what would you think? Would you think, well, that person really failed to do his duty? Or would you think that person failed to maximize utility? She says you wouldn't think either of those things. What you would think is, what kind of a person walks away from a child drowning in a shallow pond? The question you would ask is, rhetorically, of course, is about character, is about virtue, or in this case, vice. The clear answer is only a callous, unmerciful, uncaring person walks away from a drowning child. So here, in this example, Annis argues that virtue does the work. Virtue is strongly demanding. It tells us what we ought to do in this situation. So when we're confronted with a drowning child, we intuitively don't turn to duties or utility, but to character. We ask, even if it's implicit, what's the merciful thing to do here? Or what kind of a person does this act of saving the child? Well, we know it's a merciful person, a loving person. What kind of a person fails to do this act? Well, that's a callous, unloving, uncaring person. So what Annis does is she rejects duty creep, that all moral demands must be translated somehow into duties or into utility, into pleasure and pain, that virtue can be strongly demanding, that virtue can guide action. And Anna, and others, and myself included, there are some others who are arguing that virtue does provide action guidance. It provides strong action guidance. In an article that I wrote in Theological Studies in 2021 entitled Virtue, Ethics, and Action Guidance, I created this typology of how moral agents deliberate with the virtues and the virtuous. And so I'll run through the typology. So there are two different modes of taking counsel, broad modes. You can take counsel with exemplars, the virtuous, or with the virtues themselves. So on the left, you see there are modes of taking counsel with exemplars. So there's the mode of dialogue. So when I have a moral question, when I'm struggling with a moral issue, I can simply ask a virtuous person. We engage in dialogue. We do this all the time. We have moral questions, and we talk to people who we know are exemplars. They have good judgment. They understand what the good is. They live out the good. So that's the mode of dialogue. But we don't always have people at the ready to ask. So at the point of our need, our moral need, when we have to make a decision, we can't always ask someone. So what we do is we often emulate. We do what I'm calling a casuistry of character. We think about their character, and we think if they were similarly situated, what would they do? What would that person do who I hold in high moral esteem? So if you're old enough to remember, back in the 1990s, there were bracelets with WWJD on them. What would Jesus do? This is the mode of emulation. So, the bracelets were a bit trite, but there was a real insight there that we ought to be thinking about doing what Jesus would do if Jesus were here. So that's the mode of emulation. And we do this all the time. What I'm going to ask you to do, is over the next 24 hours or so, really think about how you make moral decisions. And what I think you will see is that you are often reasoning with exemplars. You're thinking about what an exemplar has done, and you're modeling your behavior on a concrete individual. You're probably not doing a utilitarian calculus or doing running your maxim through the categorical imperative. Maybe you are. It's an academic audience, so who knows? But I tend to think most people don't do that. But I think everyone does this to greater or lesser extents. Exercises this mode of emulation. And finally, there's the mode of substituted judgment. It would be wonderful if we could all do what Jesus did, or you name the moral exemplar. But often we're incapable at this point in our moral lives to reach to the heights of moral excellence of Jesus. So what we would do is, maybe I can't do what Dorothy Day did. I can't bring a person suffering from homelessness into my house. I'm not that morally advanced. But what would Day recommend that I do when I walk past a person suffering from homelessness? So what we find here, there are many different kinds of virtuous actions. We can emulate and try to do what they would do, or we can substitute their judgment for ours, right? Knock our judgment out and say, what would Day recommend that I do? So those are modes of taking counsel with exemplars. Then there are modes of taking counsel with the virtues themselves. So, there are two modes here, the interrogative mode and the discovery mode, and they both move in different directions of analysis. Basically, the interrogative mode has an act in mind already. I'm walking past the shallow pond and I think, I would like to keep walking because I don't want to ruin these really nice shoes. And so now I interrogate my action in light of the virtues. And I say, if I were to walk away from this child, what kind of an action is that? And you'd obviously come to the conclusion, it's callous, it's uncaring, it lacks courage, right? It lacks all of the virtues. So we're interrogating our action. Then there's the mode of discovery. Sometimes we come upon a situation and we don't know what to do. We simply don't know what to do. And we have to think, and I think we do this. We think, well, what's the courageous thing to do in this situation? So someone makes a comment that's racist or homophobic or sexist. And you might think, I don't know what to do right now, but I want to do the courageous thing. And then you decide to speak up and say, you shouldn't talk about X group of people in this way. I'm not going to allow that to go uncontested. So we discover, but we start with a virtue and we move to the action. Here, so if we look at all these different modes, we find that virtues do provide action guidance. in these different ways. And I think we're already thinking in these ways. This doesn't appear to us to be an imposition on our moral reasoning, but rather I'm just raising up what we're already doing. So let's look at some advantages of virtue action guidance. One significant advantage, and this is an advantage for healthcare, I think, certainly, is that virtue addresses the morally mundane. Here we have a nurse comforting a worried patient. You know, if a nurse were to walk by a patient and see distress on the patient's face, are there rules that apply in this situation? Maybe, but probably not. Are there duties? I don't think so. I mean, but again, maybe you want to articulate them. But I think we would appeal to virtue. What does it mean to be a caring nurse? And you can think about care, you can think about mercy, and that will direct you to soothe the patient. Because most medical practice is incredibly mundane. It's not fit for an ethics consult. You know, the Jahai McMath, Terry Schiavo cases are not what we're dealing with on a daily basis, obviously. You know, NRP, preterm premature rupture of membranes, continued ventilation of unrepresented patients in coma. I mean, that's the most common of these, I would say. You know, but not every issue is kind of a dilemma. Most of our moral questions in medicine in healthcare are very mundane. It's soothing patients, caring for patients. And this is where the virtues provide excellent action guidance. I'll also argue they do provide really good guidance for cases. And we could even begin to look at these cases in light of the virtues. And I would say that they provide guidance in that way as well. Another advantage of a virtue approach is that it admits of moral gradations. So we can talk about actions that are minimally virtuous, ordinarily virtuous, and exemplarily virtuous. So we're beyond the binaries of right and wrong. You know, do it or don't do it. You know, we could think about, we can't always act, as I noted earlier, we can't always reach to the heights of virtue. We can't always be like Jesus, the Good Samaritan, or Dorothy Day. Sometimes all we can do is what's minimally virtuous, right? Saving the drowning child is what a minimally virtuous person would do. Ordinary virtue goes beyond that. You know, maybe that involves, you know, stopping and talking to a person suffering from homelessness, buying some food for that person, connecting them to services, right? But what I think is so attractive about a virtue approach is, as we think about it in medicine, is it admits of moral gradations. We cannot always do the height, you know, the extreme virtuous action. But we sometimes can, but we should think about these things in terms of, you know, actions that are good, better, and best. And so we're called to even greater goodness, not just is it right or wrong, but again, good, better, and best, I think, is very helpful in our moral thinking in healthcare. Another advantage, this is a communal form of deliberation. The mode of dialogue that I discussed earlier, you know, we ask a virtuous person. So a physician who has a moral quandary can go and ask another physician who she holds in esteem, or ask an ethics committee, right? That we engage in communal moral reflection, not just the use of this tool on our own. And when we think about, you know, the modes of emulation and substituted judgment, now we're deliberating with these figures who we hold in esteem. So again, we're beyond an individualistic method here, but to a relational, communally situated method. Because none of us can discover the good alone. We really do need to appeal to a community, to exemplars into our community. And we do this in every other aspect of our lives, in our career, in the arts. But in the moral life, we're less, we don't talk about kind of finding guidance in the community as much. We're given tools for ourselves individualistically to discern and discover the good. And I think there's we can improve upon that through this kind of thinking. Which brings us back to Dr. Pellegrino. And I want to thank Mrs. Marty Patchell, who I hope is on the call today, for sharing her experiences of working with Dr. Pellegrino for decades. And we had a wonderful conversation where she painted a portrait of not only a brilliant physician and ethicist, but a very virtuous physician and ethicist. She told stories about Dr. Pellegrino. And this is key. She told stories about his faithfulness. He was a man of deep faith, about his ecumenism, how he brought in different kinds of people into his work, into his thinking. He worked with many different kinds of people. He was very devoted to his patients and his students. He was incredibly compassionate, industrious. She told stories about him waking up at 4:30 in the morning so that he was writing by 5 a.m. every morning. While being industrious isn't necessarily a moral virtue, you can use this virtue, you could use that trait for ends that are not noble. With Dr. Pellegrino, his industry was a trait that promoted the good. And finally, she noted he was the epitome of a gentleman. That when you think gentleman, you think Pellegrino. It helps to concretize and gives an embodied presence for what it means to be a gentleman. That he had that kind of character that we ought to aspire to. And so it was through the telling of these stories that we come to understand someone like Dr. Pellegrino. Our character is embodied in narrative. It's embodied in the stories we tell about ourselves or others. And we can use Dr. Pellegrino's narratives, his character traits, to provide action guidance for us. We can think when we're confronted with a difficult patient, student situation, what would he do if he were here today? Or what would he recommend that I do if I could talk to him right now? And we do this all the time. I'm sure many of you on this call have already done this. You may have done this today and thought, well, what would he do in this situation? This involves our moral imagination, right? Where we begin to discover the right action in light of the advice that he would have given or what he would have done. So it does engage our moral imagination. So we can imagine the good. We can discover the good through this kind of imaginative activity. And I think what we find is that because we are embodied creatures, the best kind of moral pedagogy is often embodied. Persons provide the best action guidance in so many ways. So I have a preference for exemplars, and I think there is a movement in philosophy and in theology to looking at exemplars as providing substantial and important action guidance. And we don't have to look far if we want to turn to Jesus in the Gospels. What's interesting about the Gospels is there is no objectified decision procedure, and Jesus doesn't provide one himself. What Jesus does is Jesus tells stories. Jesus tells stories about the Good Samaritan, right? And then he says, go and do likewise. Right? The Good Samaritan is the one who's justified that day because he treats the man who has been beaten with mercy. And Jesus says, go and do likewise. Jesus understands that we can emulate the Good Samaritan, and he calls us to emulation. And he himself is an embodied exemplar. The gospel writers don't try to develop a decision procedure. They don't try to develop a series of laws, but they paint a portrait of Jesus. He is the one who is held up as to be emulated, to draw guidance from. So we hear, all of these stories about Jesus. Jesus healing persons with leprosy who no one would have touched. Jesus touches them. Healing those possessed by demons. People were staying away from these possessed persons. Jesus heals them. Jesus weeping at the tomb of Lazarus has incredible compassion and mercy for those who suffer. Jesus defending the woman caught in adultery, not judging her, but calling her to greater goodness. And we could go on and on and on. We provide it, we get substantial moral guidance. And Christians have had substantial moral guidance for 2 millennia through these stories, either stories Jesus tells or stories about Jesus in the Gospels. And here you see on the right a picture of Gerasim of Tolstoy's The Death of Ivan Ilyich. And if you remember the death of Ivan Ilyich, basically Ivan Ilyich is dying of a undisclosed illness, and the only one who is really caring for him is his nurse Gerasim, who is in this picture holding Ivan's legs up because of the pain in Ivan's abdomen. And here, Gerasim isn't Jesus. Gerasim isn't St. Teresa of Calcutta, right? He is a near peer. So we have these extreme exemplars like Jesus and St. Teresa of Calcutta, and we could go on and on. Name saints. I'll talk about Paul Farmer in a minute. These are pretty extreme exemplars. They're not real peers. They're far above most of us. Gerasim is a near peer. And there's evidence that near peers provide, in some ways, more effective moral guidance than even the extreme exemplars do, because they're just a little bit better than us, but their way of life seems attainable. So I think we should draw guidance from both these extreme exemplars and from near peers, but near peers provide an enormously important set of persons to emulate. And I'll say more about that, because I think we need to tell stories about our near peers and our exemplars a little bit more. Because we're designed, as human beings, we naturally emulate. This is not hard for us to do. There's research that suggests we have mirror neurons, that the way that we learn in the beginning is not conceptual. It's simply by emulating and mimicking others. And so this comes very naturally to us. And I think we do this throughout our lives. And again, I would ask you to be critical about how you make moral decisions over the next 24 hours or maybe a whole weekend. So, at this point, I can say, I don't think the virtues are blind. I think they do help us to discover the good and right act. And in addition, as I just suggested, we already morally deliberate like this. This is not an imposition. This comports with our best moral instincts. We are creatures who tend to imitate. I see the time, so I'm going to move a little more quickly through these slides. Think of someone like the Venerable Catherine Macaulay, whose sisters founded so many of the hospitals in this country. Visiting the sick poor was one of her callings, and educating those who are poor. She is an exemplar of mercy. And Venerable Catherine Macaulay not only shows us what to do, we can begin to think about what to do. She makes us want to be like her in a way that the utilitarian calculus, maybe it does provide some good insight about what to do, but it doesn't call us to the good. It doesn't make us want to do the good. But when you hear stories about Catherine Macaulay, you want to be like her. She's morally attractive. We're drawn to people like Catherine Macaulay, and we're drawn to people like Paul Farmer. Again, rest in peace, Paul Farmer. He's an exemplar of solidarity. He did not allow the suffering to suffer alone. He created structures like Partners in Health, new hospitals, new protocols for TB treatments that healed the suffering of groups of people who had been forgotten, abandoned. And as we know, was inspired by his faith and by liberation theology to do this, to address the social causes of disease and to prevent premature death, what the Haitians call stupid deaths. So last slide here. I'm going to end with two invitations. One is, I think we need more stories of exemplary healthcare professionals and administrators. I think it would be wonderful, and I've thought about doing this myself, to collect essays of these people, both extreme exemplars like Paul Farmer, but also near peers, people who maybe you've worked with. I think that this mode of reasoning morally is incredibly powerful and effective, but in order to do this, we need more narrative, right? Narrative is absolutely essential for us to begin to imagine what we should do. We need to have narratives in mind of whether it's Jesus or Paul Farmer or that especially caring physician who you work with, if you're on this call and you work with physicians. We need those narratives. And finally, we need to think about formation of the virtue as going beyond information. Formation gets us to do things. It forms our heart and our character. And the only way that we do that is by having people do enact the virtues. And so, we need to call people to do that. And one of the ways that you enact the virtues, I think, and I've made the case during this talk, is to reflect, is to deliberate with the virtues, with that thick account of the virtues that we see in Aquinas or elsewhere. So I'm going to stop there. I know we don't have a lot of time left, but I'm happy to, entertain a conversation about what I've presented. And yeah, thank you for your attention. I'll stop sharing my screen now.
Thank you. Thanks very much, Dan. I appreciate that. And the things that I particularly appreciate is addressing how virtue can be seen as a real action guide, which is something that I often sort of wonder about. When I give talks about Pellegrino's internal morality of medicine and finding the right and good healing action and the necessity to interrogate with the patient what is the patient's good, often clinicians will say, there's no way to do that given the current structures of healthcare. I wonder if maybe you could talk about how institutions either decrease the possibility for virtuous action or perhaps can increase it.
Yeah, it's a great question, Father Sheehan. Certainly, I mean, institutions, what organizations do essentially is they enable or constrain your action. That's what an organization does. And the test of an organization, the virtue or vice of an organization, is what does it enable and what does it constrain? What does it enable and am I enabled to spend time with a patient, to listen to them, to care for them, to hold their hand when they're suffering? Or am I constrained from that? And you can think about constraints in terms of like punishments. What do I get punished or penalized for doing? Well, you didn't see the 25 patients that you were supposed to see today, or whatever the number is. It's hard to keep track of what the number is in terms of, so you're going to be, the chief medical officer is going to call you on the carpet and say, you're not pulling your weight. Well, that means what you're enabled to do is to just fly through your patients. And if there's a patient who has a significant issue that you need to spend more time with, or even provide some real care and bedside manner, so I think we need to. It's a great question because you cannot become virtuous alone. We are often only enabled to become so virtuous given the institutions we exist in. And so I think we need to be critical about what our organizations enable and constrain. I think that should be that's a central role of any leader, is what am I enabling my professionals to do, and what am I constraining them from doing? What am I penalizing them from doing? It's a great question, and it's a question that, there's a lot more to be said. And this really gets to organizational ethics and virtue too. Yeah.
Yeah, I mean, as you would talk about the narratives of people who are either near exemplars or exemplary exemplars, to look at what is the milieu in which those people can grow and be fostered. This brings me to another question. We do a lot of ethics consults at MedStar Georgetown University Hospital here. So it looks like we might be on track for about 200 this year. And sometimes within the literature of healthcare consultation, you can see different models where it seems to be procedural or fairly remote. Do you have a sense, and you did healthcare consultation back in New Hampshire, is there a role for the ethics consult or the consultant to be a person who is fostering virtue in the clinical environment?
Yeah, I certainly think so. Yeah, I think, I think first of all, you can't, all of these kind of decision procedures or whatever procedure you're using clinically in the hands of someone who is callous and imprudent, they're dangerous. These tools are dangerous. None of these principles or procedures apply themselves, as I noted. They need to be in the hands of people who have the virtues, at least to a certain degree. But yes, I mean, I think, we need more cultivation of these character traits. And I think Dr. Pellegrino, this is where Dr. Pellegrino's work really has incredible insight, but has not been realized. It seems to me that we don't focus enough on the formation of the character of persons. Rather, we ask them to just use these tools almost mathematically, and that is really not the essence of what ethics is. It isn't the essence of Catholic ethics, but I would say, Aristotelian ethics, that would be anathema for Aristotle as well. You don't have to be a Catholic to think that ethics is not a form. It cannot be done through formula. Aristotle writes you can only get the level of precision in each science as each science admits of. And he notes ethics is not mathematics. It does not admit of that kind of level of precision. We need prudential discourse and dialogue, and we need to cultivate that in our leaders and in our decision makers.
One of the things that sometimes is used with the virtues is to look at what the telos is for that person or for that community. Since, I mean, is there such a thing as a virtuous Nazi, which
Right.
sounds like a contradiction in terms, but, someone of exemplary courage in doing horrendous things.
Yeah.
And can we use a general theory of the virtues to at least evaluate the nature of groups of practices, institutions, communities?
It's a great question. So, Alistair McIntyre's incredibly important work, After Virtue, one of the most important things he writes in that book is every account of the virtue is predicated upon some prior notion of the good. You can only name the virtues in light of a prior notion of the good. And and those are up for debate. Like, what is the good life? Is it pleasure? Is it the avoidance of pain and the pursuit of pleasure? That would be Bentham's account. Aristotle's account would be, the full flourishing and functioning of the person, which involves, relationship and reason and so on and so forth. We could talk about a Christian account, or we can talk about, but we do need to have a prior notion of the good in order to then name the virtues off of that good. So you're absolutely right. I mean, any virtue account is by its very nature teleological.
Yeah. We have a question from someone in the audience asking, what are the avenues or platforms to share more stories of virtuous near peers? Are there any established ones already?
I've done a little bit of research in this area. I haven't found any, you can find them sporadically, or you can find them maybe in certain biographies of people, but not to my knowledge. I think what would be really great is to have a place where we could all go and read about narratives of exemplars, near peer and extreme exemplars. But it seems to me that doesn't exist in the healthcare space. I mean, it does exist in other spaces, but not in healthcare, because I would love to see examples of, we have so many administrators and so much power is concentrated in healthcare administration today. Who are their exemplars? It's harder for them to imagine, emulating Dorothy Day or Saint Teresa of Calcutta, Venerable Catherine Macaulay. It's a little distant. I mean, you can do it. I think you can do it. The moral imagination is a powerful thing, but it would be great if we had narratives of administrators who acted with courage, who did the good, who ensured solidarity with suffering populations, right? Who did justice to those who have been forgotten. If I were an administrator, I'd want to read those stories.
Yeah.
That provide me a lot of action guidance and a lot of inspiration.
I mean, what you're talking about, it reminds me a lot of as a kid being brought up on Lives of the Saints, or in a secular thing, in school, giving all these stories about different heroes, that much of our moral education does revolve around the narratives. And that I think that, particularly in our postmodernist time, which maybe we're postmodern now, the notion of, again, people as being peers or something to emulate, in the past, I think has been poo-poo, but does seem to be that there's more of like, that person seems to get right what it means to be a human, and folks like to watch that.
Yeah, I could not agree with you more. I mean, we're post we're post-hero,
Yeah.
like we've got the kind of the whatever the superheroes, but those aren't, we're not emulating our lives on those folks. But we need moral heroes. We need moral exemplars. And, in an individualistic society, we tend not to think we are our own unique person, which is true, but that we're not going to model ourselves, on anyone else. That is to be like someone else. That is not to be authentically me.
Mhm.
And that the point of emulation is not that you lose who you are. It's that you can only discover who you are in a community.
Right.
It's a fallacy to think that I can become myself without emulating others. And again, in fact, we're always doing that anyways. Let's just raise it up and make it explicit and invite others to do it in a way that helps us to become better.
And it makes me wonder if some of the, working with clinicians, with medical students in a hospital environment, whether it was at Georgetown or Loyola when I was in Boston, um, I'm often struck by the overemphasis on autonomy, and that most of the ethical questions that we come up with in the hospital require a communal response, and that the way in which the principle, and it isn't what Beecham and Children said, particularly in their later editions, this sort of atomized autonomy, but the importance of really looking at how does this, what does autonomy mean for an individual who's part of a community rather than some solipsistic thing.
Yeah. Yeah, I think it's a good point. I mean, our autonomy is always capacitated by our community. The idea that I have choices of the kind of medical care I'd like is predicated upon the existence of other people who can provide that care.
Yeah, yeah,
Right. So
yeah.
it's my autonomy is never simply my own. It can only be exercised truly because I exist in a community. Um, yeah.
There is a comment from our very own Professor Laura Bishop of the Kennedy Institute, who sends a note saying that James Rule and Muriel Bebo, I don't think I pronounced it right, wrote a book in 2005 called Dentists Who Care, Inspiring Stories of Professional Commitment. And both authors were concerned about dental ethics and ethics in dentistry. And she recommends this as an ability to, as an example of looking at moral and professional exemplars in dentistry, and presumably would provide an example for other professions and other communities. Um, it's past 4 o'clock. I really had a good time. I wish people asked more questions, but I had fun asking my questions.
I had fun answering them. Yeah.
And so I want to thank you again, Dan, for a really rich and useful presentation that is really has my little head going right now. I don't know I hope I don't have too many moral choices over the weekend, but but probably will come up again as we face the future. So again, thank you very, very much for joining us today, and I appreciate your presentation. So on behalf of the audience, the Pellegrino Center, I want to thank you and wish you all the best.
Thank you. Thank you all.